edition of Healthline 3. Joining me today are two new doctors to the Healthline family. They are Dr. Kamel Braka and Dr. Jim Burke. We're excited to have you both here, both with Willis-Knighton Health Systems. So we've been talking a lot more lately about this whole situation with the robotics surgery. And I do like this because this is literally what you guys look like inside of this giant machine. For those people who have hesitancy to this because it's more modern, it's the new way of doing business, what is it?
So just along the lines of what you said, some patients are still hesitant about the technology because I still get patients that ask me whether the robot is doing the surgery or whether I'm doing the surgery. So just to clarify, the robot is simply an instrument that allows us to perform the surgery with much better precision and accuracy. And it's really, again, it's an extension of laparoscopic surgery. It's within the same realm, except it is much more advanced and allows us to do the job with, again, much more precision and accuracy, which translates to less trauma to the patient, less surgical trauma and less blood loss, which enables the patient to obviously do better in terms of getting up and going back to normal activity, because you're doing the surgery through a very small incisions that are about 1 centimeter or half an inch.
I heard that the robotic system is so precise that it's almost like sewing back on the skin of the grape, that you can do it to that level of precision. Tell me a little bit about the background of this, the robot.
You can. It started several years ago after the laparoscopic cases were progressing, and then we came with the robot. Initially, their robot was somewhat cumbersome, but as it progressed and became much more used, or it was much more available to us, then we were able to do things much easier with much more precision. The optics of it are much better. You can see better with the 3D pictures. The instruments now no longer have a drag on the instruments. With the laparoscope, there used to be a drag as they went through the ports. That's all been corrected and no longer there. So the very fine movements, the 1, 2, 3 millimeter movements that used to be quite difficult, are now very easy. So it gives you much more precision with your surgery. So
you're decreasing the trauma to the body because of the way that you're able to enter, the way you're able to see things with this now 3D view. What is it like when you're doing a surgery like this? Does it also go quicker?
Well, there is a learning curve. Obviously, once you become proficient with the robot, then the time of the operation is just as long as conventional open surgery or laparoscopy. And in some cases, even faster, depending on what type of procedure you're doing. But really, the other superior aspect of the robot is that the three-dimensional camera, which magnifies the surgical field, anywhere from 8 to 10 times, which allows you to visualize the tissues much better and perform with a lot more precision and accuracy.
Sounds good. Like, so a doctor, if he has, glasses or anything like that, now he can actually see everything in 3D, and he's not guessing or wondering what's beneath this or what's behind that.
Exactly, because the vision is, superb. You can see everything, and there's less room for error, as opposed to laparoscopy. You're only seeing two-dimensionally. So with a robot, it's a three-dimensional vision with the depth that allows you to basically see the tissues, where the tissues are laying, what's next to the tissues, so which allows you to prevent any potential or any risk for injury.
Sounds like a win-win to me. Tell me a little bit about some of the procedures that you guys actually perform when you're doing the robotic surgery.
There are many different ones we perform. As general surgeons, we perform a lot of hernias, stomach surgery, gastric surgery, colon resections, and it has progressed to the area now that you can do much more than we thought we could, and there's much less tissue damage by doing it with the robot than the conventional open procedures.
So let's talk a little bit about that, because I think you were mentioning to me yesterday, Dr. Braka, that you do a lot of hernia surgeries.
Correct. So with the robot nowadays, again, hernias are a lot easier to repair surgically than otherwise. Conventionally, in order to repair an abdominal hernia or an abdominal defect, you'd have to make a big incision, repair the hernia, and the patients are usually in pain for up to 4 to 6 weeks. They're limited to how much they can do throughout that period. Now with the robot and being able to do these hernias through small little incisions, patients are able to leave the hospital quicker, they're able to return back to normal activity quicker, and most importantly, they're experiencing less pain and less scarring, of course.
What exactly is a hernia? Dr. Burke?
Well, it's really a protrusion from one body cavity to another, or a break in the abdominal wall or the muscle fascia. And then it develops an outpouching, and almost like a sac coming out as a balloon would blow up in that area. So it's really a defect in the muscle layers with that.
So somebody would absolutely know they have a hernia because of the protrusion.
Most people get a protrusion, they can get pain. The worry with hernias is them getting incarcerated or stuck in that hernia sac and having compromise of the blood flow to the bowel, and the bowel becoming ischemic and possibly dying. Is
surgery the only option, and is it immediate?
So obviously there are a variety of different hernias, and hernias, it's a progression, because a hernia usually starts small, starts with a defect in the abdominal wall that may eventually progress because activity, part of why patients or any given patient might have a hernia is because as you're active throughout your job, you're physically active, there's a lot of pressure on those areas, and that hernia continues to worsen, continues to enlarge. Eventually a patient may experience a bulge or notice that something is protruding out of their abdominal wall, depending on where that hernia is. And there are different kinds of hernias. There's hernias that are within the groin, there's hernias that are around the belly button, or anywhere else on the abdominal wall, especially if patients have had previous surgeries or previous operations.
Are they still very common?
They are. Hernias are very common. It's one of the most common procedures that we do as general surgeons.
All right. And again, how quickly is it from the time that you see the patient to the time that you decide, okay, they need to get surgery? And is there any other option?
Well, surgery most of the time is the only option, unless their overall general condition prohibits from being put to sleep.
Okay.
You would like to get a hernia as soon as you can when it's small, because it's always easier to repair a small hole than a big hole. As they get larger and larger, say from just a few millimeters to now 5, 6, 7 inches big, it's much harder to repair that hernia, and the odds of that hernia recurring also go up because of the size of it.
So when you are doing the robotic surgery with the hernia, what is the big difference there as opposed to the laparoscopic form?
So with the laparoscope, you can still repair a hernia laparoscopically. The task is a lot more difficult because, again, laparoscopy only has straight instruments that are only operational within two-dimensional movement, so to speak. With the robot, you have these instruments that are wristed, endo-wristed or jointed, so to speak.
Mm-hmm. And so that the public understands, it can move the way
correct.
Your hand and your wrist move.
Correct. So your motion of your hand translates through those robotic instruments, and it allows you to do tasks that are a lot easier than would otherwise be with the laparoscope. I mean, in the degree of 10 to 20 times easier than the laparoscope. Not only that, you're also able to be a lot more precise in your repair, which renders the repair stronger and durable than just laparoscopy.
All right, Dr. Braka and Dr. Burke, it looks like we already have our very first caller, and Debbie is on the line. How are you doing this afternoon, Debbie, and what questions do you have for the doctors?
I'm doing pretty good. I've got a doctor's appointment this afternoon, and I heard y'all talking about hernias. I have 2 lumps on both sides of my stomach. I deal with IBS, and so I go through diarrhea and constipation, and I had a real bad bout with the constipation, and then I started feeling these lumps, and I can't get anybody to check it and tell me what it is.
Are you guys able to hear her?
Yes.
Okay.
Are these lumps down in the groin area, or where are they?
No, they're on the side. They're above my hips. I'm wondering if it's on my intestines, because it's on both sides of. I have 2, one on each side of my stomach. So I don't know if it's my stomach. I don't know if it's my intestines.
It could be an area in the groin region and be an inguinal hernia or some type of hernia on your abdominal wall. The best thing would be to have one of us evaluate it to see what we think it is, and to see if it could be a hernia or it could be a lipoma or other things that might not be a hernia. So I would say just call one of us and we'll evaluate it and see what we can do.
Are y'all in Louisiana? I'm in Northeast Texas.
Yes, we're in Shreveport, Louisiana.
How can she find you guys?
You can just call our phone number, which is 318-212-6270.
Yeah.
Did you catch that, Debbie?
I didn't.
The phone number is 318-212-6270.
And they are currently accepting new patients right now, so you can go in and have a consultation at least?
Sure.
Yes, we'll be happy to see you.
We can also do a CT scan if need be, which is an imaging modality that will help us delineate and
Okay,
exactly
question
what's
for
going
you.
on.
I was in the ER and they did a CT and they couldn't see anything.
So we can always review that CT and look at your, everything else that you've done so far, and we'll figure out what's going on.
Where was the CT performed? Was it in Texas or where was it?
It was in Texas, Mount Pleasant, the hospital in Mount Pleasant. I went blank on the name.
Okay, well, what you can do in that
Titus
situation,
Regional.
if you're close to the hospital, you can go to the hospital and they can put that CT scan on a disc, and you can bring that disc to the office when you come, and then we can get it uploaded, and a lot of times use that CAT scan and hopefully prevent you from having to have another CAT scan.
Okay, perfect. I will do that today when I'm over in Mount Pleasant, and I will give you all a call.
That'd be
All
good.
right.
Look forward to seeing you.
All right, thank you so much for calling this afternoon.
Thank you.
Thank you, Debbie. Let's talk a little bit as well about gallbladder disease. I know we talked a lot about the hernia. Gallbladder disease is something that a lot of people don't even realize that they have, and it has to do with the symptoms kind of overlapping with other abdominal issues. So oh, wait a minute. You guys are so popular. It looks like we already have another caller on the line. Linda, what are your questions this afternoon?
Well, I heard him mention lipomas. I have a fatty lipoma on each ankle, and one on the upper part of my leg. I've never done anything to them. I have always had the feeling if it's not bothering you, leave it alone. What is your opinion?
Yes, if it is not bothering you, it's not causing any pain or discomfort or interfering with your lifestyle, then that's certainly an option. You don't have to do anything about them, as long as they are lipomas, of course. But if you're having symptoms or having any issues, then you can certainly consider surgical options.
What about
Is that sort of hereditary?
They can be.
Yes.
Correct.
Yes, my son has one. So, just curious. Thank you so much.
You're very welcome.
Can it become problematic over time?
It can if it continues to enlarge and interfere with your daily activity. Sure.
Is it best for her or someone who is seeing those kinds of symptoms to at least go and see a physician as soon as possible to get it taken care of?
Seek a consultation and we'll take a look, and absolutely.
Should have it evaluated just to see, as Dr. Braka was saying, to make sure it is a lipoma, because other things can mimic a lipoma. And people have different amounts of them. Some have a few, others have multiple, as many as 20, 30 on their body that we intermittently take out.
And what office are you guys working out of? Which Willis-Knighton?
Willis-Knighton North.
North,
Yes.
okay. And you guys are currently, so that the public knows, they're currently accepting new patients. So if you guys would like a consultation, you can definitely give their office a call. And let's get that number one more time.
It's 318-212-6270.
All right. And you guys heard it right there. So explain to me just again what she was asking about. I'd never heard of this.
So these are essentially what we describe as fatty tumors. They're lumps that can be felt anywhere in the body, and they're fatty tumors, and they continue to grow over time. And sometimes they can cause discomfort. They can interfere with your daily activity. They can cause, again, the most common complaint is really pain, and also sometimes cosmetic appearance also
Which is a big concern.
Correct.
All right, it looks like we have another caller on the line. Charles is calling us this afternoon. How are you doing, Charles, and what questions do you have today?
Yes, I'm doing good. And I have a question about the hernia surgery.
Sure.
What is your question?
Yes, I was wondering, do you still use the hernia mesh when you do the hernia surgery with the Da Vinci robotic surgery?
So, so meshes are very common in hernia repairs. Depending on the size of the hernia, the location of the hernia, it also depends on your overall medical history determines what mesh is used and where it's used. So, do you have a specific question about a specific hernia that you may have, or?
Well, I've had hernia surgery before. Of course, I just had the general surgery, and I had one in the groin on the right side, plus one under the belly button. But I was wondering if the mesh was still used in the robotic surgery, and I noticed before I had a lot of pain for probably, like you said, 3 to 4 weeks.
So, how did you have that hernia repaired? Was it repaired open from the outside?
Yes, it was open. It wasn't laparoscopy. It was just regular surgery.
Right. So that type of repair can cause more pain than the usual robotic repair, because the robotic repair is different than the open repair. If you do it robotically, the repair is from the intra-abdominal, meaning you go inside the belly and you're repairing that hernia from the other side of the abdominal wall, as opposed to the open, which is from the surface on the outside.
With the robotic repair, there's much less tissue damage than doing it the old conventional open way. So most people have much less tenderness by having it done with the robot than the conventional way where we used to do it all open. People are back to work much faster.
Correct. But in both cases, go ahead, I'm sorry.
And you're in the same building that Dr. Shelby's in. Is that the one, the north? Right
next to that building, in the medical arts building.
And would you like to give them a call?
Yes, I'll give them a call.
All right.
And I got the phone number a while ago.
All right.
Sure.
Excellent. Thank you, Charles, for calling in. Does that answer all your questions today?
Yes, ma'am. Thank you.
All right. We're getting a lot of calls today.
Good.
You guys are pretty popular, which is not normal when we're talking about general surgery. You don't think a lot of people are paying attention to this, but it's obviously impacting so many areas of the body. So let's go back to talking a little bit about the gallbladder disease. What is it exactly?
So gallbladder disease is essentially gallstones that cause discomfort. Patients may experience, usually the typical presentation is that a patient may experience pain, nausea, vomiting, especially after they eat. Anywhere from 30 minutes to 2 hours after they eat, they may start experiencing those symptoms. Sometimes the symptoms are very vague. They can happen anywhere in the abdomen, the upper abdomen. They can also go to the back, because gallstone disease in of itself can present in a lot of different ways. And if you keep having those symptoms, then you should certainly seek medical advice from your primary care physician, which then will do some studies and some tests to figure out what's going on, and then you'll end up being referred if it is gallbladder disease.
How common is it, and do you tend to see these types of surgeries more so than the hernia?
Both of them are very common. It's hard to say which is more prevalent. The gallbladder disease is very prevalent. It's a lot of people get strange symptoms, bloating after meals, right upper quadrant pain tend to be exacerbated by very greasy foods a lot of times.
Okay. Yeah. So it tends to overlap with other symptoms like IBS or?
Correct. Tends to overlap with a lot of symptoms, a lot of upper abdominal. It can mimic ulcer disease.
And how do you guys test to determine exactly that that's what it is?
Well, normally you start off with an ultrasound to try and see if there are any gallstones. If the ultrasound is negative or does not show any gallstones, you can get a test called a Hepatobiliary Scan or HIDA scan, which measures the function of your gallbladder, because sometimes your gallbladder may not be functioning properly and you can still have the same symptoms as if you had gallstones. So there are a few different tests we need to get a lot of time to fully evaluate the gallbladder function and the right upper quadrant pain.
And in either way, does the procedure ultimately lead to surgery or
Correct.
the treatment?
Both of those diagnoses, whether it's a function or whether it's gallstone disease, the treatment is surgical removal of the gallbladder, which then gets rid of those symptoms. Correct.
And how quick can that be done?
Usually, if a patient is experiencing symptoms and they come for an evaluation, they can be scheduled within a week or so.
When do you recommend that someone say, okay, it's time for me to go and see a physician about this? Because most people will tend to push aside pain.
Right. If you are experiencing pain and you're suspecting that that's a possibility, I would say seek medical advice right away. Because what happens with the gallbladder, disease is if it's left unchecked, then it can be progressive, and eventually the patient can have inflammation, they can have an infection, which then makes the procedure a lot more complicated, and it increases the risks for complications.
Once you do get to that point where we say, okay, it's time for us to get in here and perform this robotically, how quick is the procedure and how fast is the recovery?
The recovery is actually very fast. We've done people on a Thursday or Friday, they go back to work on a Monday.
Wow.
A lot of people take 5 to 7 days off to let the soreness recuperate, and it's a very good procedure. It's 25 minutes or so to perform it once we get started, and everything is progressed in the OR.
All right. And then there was something yesterday that we chatted about. Is there anything else that you wanted to say in terms of gallbladder disease?
No, I was going to say that if as long as the disease process has not progressed and it's we catch it early on, then it's a very straightforward procedure. It's an outpatient. You come in same day, go home same day. It takes about 30 minutes. And then we just check on the patient in the office, usually a week later, just to make sure everything is going well.
All right. Another reason why someone needs to continuously go and check in with their physician
Correct.
and not push aside abnormal
Correct.
pain.
Correct. Especially if you're a male, because from my experience, males tend to be a little bit
Are they babies?
stubborn and ignore the pain. So.
Yes, they put it off for too long.
Exactly.
We were talking yesterday about bowel resection surgery, or you had another term for it.
Or intestinal surgery.
So that's just the general blanket umbrella term.
Correct.
For all of these type hernia surgery, gallbladder surgeries. Is that what that means?
Correct.
Okay.
And intestinal surgery, meaning intestinal or bowel surgery, anything that involves the intestines. It could be small intestines or large intestines.
All right. Let's go back to talking a little bit about the hernia, because it seems like it's pretty popular here. I didn't realize that so many people are impacted by hernias. And you say that there are various types of them, correct?
Correct. Yes. So hernias are pretty prevalent. A lot of patients have hernias, and because they don't cause a significant pain or significant sort of problems in their daily life, they may not have them checked or seek advice. But one of the recommendations nowadays is, if you have a hernia, is to have it checked out right away, because the earlier you intervene, the less complex the operation is, and the less the risk of reoccurrence. And the reason we also recommend that hernias get treated, so that patients are able to get back to their normal daily activity. Because as especially if your job is physically demanding, then that constant pressure can actually increase the hernia, which then in return limits your function and your activity. So it's and that's why it's better to have these fixed.
How do you get a hernia?
Well, hernias can be different reasons. One, you can have incisional hernias when you've had previous operations, and sometimes that will recur where you went in with the big open operations. Other times you have the inguinal hernias. Sometimes that is from lifting heavy things. You see a lot of times people lift very heavy objects and have pain in that area, then later develop a hernia. Some people have them congenitally, or weak areas in that area, in their groin areas, or the umbilical areas.
Can it be induced by stress at all, or is it just something that is a physical?
Right, it's usually physical activity. Some of these defects are present at birth as well, and then over time they can increase in size because of physical activity. The added weight or overweight, patients who are overweight tend to have higher risk of developing these hernias because of an increased intra-abdominal pressure that pushes through those existing defects.
So a hernia can be family history related, it sounds like.
Correct. There is some hereditary component to it as well.
Okay.
Because some of these defects are present congenitally or at birth. So.
When you do finally see the patient, has it gotten to a point where it's just they're in bad pain and now it's time we need to correct this, or can you do this even early on?
You can do it early on before it progresses and it presents to where it significantly impacts your lifestyle and your daily activity. Again, because by then, if you already have organs that are protruding or bulging through that defect, because now you have a significant defect and it's really limiting your lifestyle. So the recommendation is to have these fixed early on so that they don't progress to that level. Because the other thing that can happen is if the intestines or the bowel is bulging through that defect, then it can choke off that bowel and compromise blood flow, which at that point it becomes an emergency.
Wow. When we got the call a little bit earlier, the woman who was seeing some of the protrusions, I believe, on her legs,
correct.
Was that related to a hernia, or is that only abdominal?
It's the hernias are, in terms of the general surgery realm, are only abdominal. So in your extremities, those are lumps, bumps, masses, things that are not hernias.
Okay. And did you want to say something, Dr. Burke?
Oh, you're talking about the lady with the bulges on each side, or
Yes,
on the leg?
yes. I didn't understand exactly where the placement was.
The problem. We couldn't exactly tell where she was saying. There was somewhere on her abdominal wall, so it was hard to tell if those were hernias or not. That's why we would need to look at it and see.
And at some point it can present not only just a physical pain or defect, but it can also be aesthetically unpleasing, and in which case you guys would come in and make sure that you can correct that.
Correct.
Correct. But as Dr. Braka said, you like to get them way early, way before they get to the point of strangulating, which is what he is talking about, and you come in and it's a more emergent operation. You would like to do it more of an elective, so everything's much easier, and you don't have a lot of inflammation and other problems that you have when you come in acutely with the bowel blood flow compromise.
And is there anything that I'm missing or not asking you guys when it comes to some of the procedures that you perform?
No, the other type of hernia that we also deal with are what's called a hiatal hernia, which is a hernia in the diaphragm where the esophagus comes in to join the stomach. So sometimes that defect enlarges and part of the stomach can herniate through that defect into the chest, which then can cause acid reflux and can cause all kinds of problems as well.
How is that? How does that even occur in the body? Or is there anything that someone can do to limit?
No, there's really nothing you can do. Again, this is a defect that's already there, and over time it can just stretch. And also at birth, some patients have bigger defects than others, and it can enlarge over time. And as a function of that intra-abdominal pressure, the higher that intra-abdominal pressure, the higher the risk of herniation in general.
To help avoid surgery, that's the last resort. Most people want to try and avoid that as much as possible. Yes. Is there anything that you guys recommend that patients should do either, throughout their life, some lifestyle changes that they can incorporate even after surgery?
Yeah, of course. As it pertains to hernias, I counsel all my patients that the best way to reduce a reoccurrence or have other hernias is basically to have, obviously live a better lifestyle. If patients are overweight, the recommendation is to lose some weight, because weight tends to be proportional to the risk of reoccurrence of a hernia. Again, because of that, the more weight we carry on, the higher that intra-abdominal pressure gets, and that's how these hernias develop, and that's how they can reoccur as well.
Dr. Burke?
It can also, as he's talking, it can stretch out your abdominal wall to where the abdominal wall becomes thinner and makes it easier to have a defect in the abdominal wall.
All right. And once again, we have about 90 seconds left here. You guys have been pretty popular with the public, so we want people to be able to find you.
Yeah, obviously, we just gave out our number, and we're at the Willis-Knighton North facility. We're in the Medical Arts building on the 3rd floor. And again, that number is 318-212-6270.
All right, and folks can just call in and schedule a consultation. Are those free of charge, at least just to at least see the patient?
Patients can two ways. They can either be referred by their primary care physician, or they can contact us directly, and we'll be happy to, one of us, Dr. Burke or myself, will be happy to
see him.
And real quickly, we have less than 1 minute left. Dr. Burke, where did you receive your training?
At LSU, went to med school in New Orleans.
New Orleans, yes. And did your residency?
Residency up here, and then did a laparoscopic fellowship up here.
And you've been doing this how long?
Since graduated in 2000.
So we know that we're in good hands with you.
Started practicing in 2000.
I love it. And you're close to my age, I believe. So.
Yes, I did my training in Washington, D.C. From 2008 to 2013, and I moved here about 7 years ago now. So I've been practicing for a little over 7 years.
A little over 7 years doing surgery, and we've got 20 years here working together. Thank you so much, you guys, for joining us today on Healthline 3. And for everyone who called in today, thank you so much. Have a blessed and wonderful day. And you can find more information at ktbs.com.